most famous physical therapist on the internet.
Hi folks, I'm Bob Shrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to cure urinary incontinence with Kegels exercises.
Kegels?
Is it Kegels or Kegels?
Well,
probably
it depends
Kegels.
on what country you're from, I think.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobbrad.com and go to the giveaway section because we're always giving something away.
That's right.
We'll show it to you in a minute.
Just a
you
minute.
Can also go to Facebook. It'll be pinned to the top of the page, our contest.
That's right.
And go to Instagram or Twitter or TikTok if you want a 60-second version of our program. And as you might know already, this is a podcast. We're talking today.
Yeah.
So
podcast away, Bob.
show-
But they won't be able to see.
They won't be able to see
the
this.
giveaway.
We're giving away a FitGlide,
Right.
which is a device very lightweight that you can actually work your legs in a seated position and also lying down.
Yes.
We won't show that now.
No, but yeah, you can take it to bed with you and work it. It does different angles. It weighs 5.1 pounds. You can pick it up and do what you want with it. Hang it up in the closet.
All right, Kegels exercises. Now, I've been asked by a family member a long time ago to show her how to do these, and I really didn't have much experience with them. So now I've read a couple books on it, and I've been doing them myself.
Yeah.
And I'll talk about that some other time.
Self-help books, I suppose.
Yep. So, what is urinary incontinence? It's involuntary loss of urine.
It's embarrassing.
Yeah, it's embarrassing. You could be laughing. You could be getting off the floor. You might be jumping.
Right.
Really common among young women, even in sports.
Sure.
Trampoline, obviously. And as you know, you got to rush to the bathroom. If you don't make it. So, I had a family member, an older family member, that really had trouble with this, and it really socially isolated him.
Sure.
I mean, it's not really a laughing matter at all.
No, it isn't.
It causes depression and loneliness, and it's going to impact your social life. You don't want to date someone because you're afraid of.
Right. Your spouse may not want to be with you.
Right. So
I mean, they do, but it's awkward.
So a lot more common in women. Some reports I saw, 1 out of 3 women have it, and over 65, 1 out of 2 women.
Yeah.
So that's very common. Actually, believe it or not, 1 out of 20 men also have it. But my wife made an observation. She goes, "You go into the store, and there is all these male depend diapers there,
which are made for
incontinence."
Right.
So it may be a bigger problem than we're
I think men just won't admit it.
Men won't admit it. No. They'll let it go. But
not me though. I wouldn't.
Yeah, you admit it. All right. So what we're talking about here for Kegels or Kegels exercises is we're trying to strengthen the muscles on the bottom of the pelvic floor. So it's attached, actually, the pelvic floor is attached to the sit bone here, not the sit bone, coccyx, tailbone, and up to the pubis. So it's right in this area here, right where my hand is.
That's why they call it the pelvic floor. It's literally on the bottom of the pelvis.
And it supports everything. It supports all those structures down there. You've got 2 layers of muscles, a superficial and deep layer, but you don't have to worry about that because when you can't work them separately.
Mm-hmm.
If you're working one, you're working them both. So it was developed by Dr. Arnold Kegel in the 50s. Very popular now.
1950s.
1950s,
okay.
Right. So the pelvic floor, you can control it voluntarily, but it is also, which is an intentional muscle contraction, but it is also an automatic type of muscle that's working when you're not even thinking about it.
Right. It'll automatically contract and take care of business.
So like when you're lifting something or carrying something, it's kicking in so that you don't go to the bathroom while you're...
Yep. It closes those sphincters off and you're sealed.
So what should happen when you feel a pelvic floor contracture? You're going to have a gathering of the pelvic floor muscles, and it's going to contract and lift up a little bit. That muscle is actually going to lift up. Yeah, and also, we got to apologize ahead of time here. We're going to use some graphic language here. I mean,
we'll be professional.
It's appropriate, yeah. But your anal sphincter, it should also be lifting up. Now, with the ladies, and in the men too, you're going to feel the perineal body lift up. Now, the perineal body is the area between the vagina and
Mhm.
the anus.
Mhm.
And for the men, it's between the, what do I say? I'll say testicles
Yeah.
and yeah, scrotum.
Scrotum.
How about scrotum
There you
and
go.
the anus? So we'll talk about that. That you can actually feel that with your hand.
Sure.
You won't do it in public, but
Right.
when you're trying to learn
So you want
the
to feel
exercise.
that movement. Yep. And
Yep,
you
you
want to
want
be
to
able to
feel
do
that.
it on command. You're volitionally or your mind is telling you, and you feel like you have good control.
Yep, you should continue to breathe normal. People should not be able to know that you're even doing it. My wife and I are joking that we've been doing these, and you could be talking to each other and doing it.
Sure.
I mean, we could be doing it right now. So, what should not happen when you're doing the pelvic floor, Brad,
Hmm.
is you don't want to contract outside muscles. I've seen this on some other
Sure.
channels. Like, you don't want to tighten up the glutes, the inner thigh, or the abdominals. You don't. I mean, the muscle you want was working down there,
You want to isolate.
isolated. So
Hmm.
don't hold your breath. You should be able to talk. Don't tense your eyebrows or your shoulders or your body parts.
Sure.
Yeah.
I would think that this is going to require initially some practice by yourself,
Practice by
get used to
yourself.
it, and it becomes
And if you have
easier.
trouble, there's therapists that
Yeah.
specialize in this area.
Right.
We had a couple therapists. That's all they did.
Right.
So
Sure.
So these are the common cues, and these are the ones that tend to help. We'll talk about it for women and for men. So with women, they tell you to squeeze, lift the pelvic floor. They told you to contract like you're trying to stop the stream of urine from
Hmm.
happening, but they don't recommend doing that because it can actually result in urinary tract infections, and
Oh.
I guess it can screw up your urinary reflex. So you don't want to actually start going to the bathroom and then stop it.
Oh, sure.
You know,
Midstream.
yeah, you want to think about how that feels
Right.
and then apply it.
Okay.
Um, you can. I mean, again, I'm gonna get a little graphic here, Brad, but you're supposed to imagine lifting and holding something in your vagina.
Sure.
That's another one. You're supposed to squeeze like you're trying to hold in gas.
Yep.
I think we've all done that. So, or imagine pulling your sit bones together. So these are the sit bones. I first misstated it at first. That's these two bones. They're the bones you can feel when you're sitting on.
If you're on a hard surface, you can feel those bones.
Yeah, you're supposed to feel like you're pulling those together,
Sure.
and that'll help lift that area up. Now, for men, this is kind of interesting. They did a study on this, Brad, and they
Sure.
had all these cues, and the best cue that worked for men was you're supposed to feel like you're shortening your penis.
Like
Don't
the,
make a joke.
but
Don't
it's
make a
like the
joke.
turtle.
Yeah,
Bring the
like a turtle, right,
Yeah.
right.
Guys
So,
understand that.
yeah, but it's funny when I do that, it feels like one, it works, and two, it's an easy cue to understand. So I don't know why, but
I bet your wife knows when you're practicing that.
yeah.
I mean, she knows you.
So, okay, for positioning, you can lie on your back with your propped up on a pillow, or you can have your knees up.
Mhm.
You can be in a quadruped position, Brad. Believe it or not.
So
Yeah. Um, and if you don't start that way, you might want to progress that way to doing it that way, to do it sitting, to do it standing, so you can do it, apply it to all
so did
situations.
you would start lying
I
down
start lying
on
down.
your back?
Yes, yes.
Okay.
That's what I would do.
There. Okay.
So this is how you can feel it.
How
And
many
ag-
repetitions? We're getting to that.
They got different ways of doing this. One, you can start like 8 to 12 reps, Brad, and do a 10-second hold.
For so that
Yeah, so
eight-
hold for 10 seconds,
Yeah.
do another one, do 8 to 12 of those.
And then rest for 10, or
Then you can do it like 3 times a day.
so you're gonna hold it for the
10
contraction for, and then rest for whatever.
whatever.
And then do it again.
Yeah. There's also, and they said you want to get up to like 100 reps a day. So
So not in a row.
not in a row.
Yeah.
And there's also, it's a slow twitch and a fast twitch muscle fiber.
Oh, really?
So you can actually do somewhere you do 1 second hold, 1 second release, 1 second hold, one
Sure.
second release. So you want to kind of throw both of them in there,
Yeah.
Brad. Um, so these are the ways to feel it. This is a little bit, I don't know if you want to say grotesque, but one way you can tell whether or not it's working is you could take a small piece of tissue paper
Yep.
and put it over your anal sphincter.
Yep.
And if you're doing it right, it's actually going to kind of suck that paper up a little bit.
Really?
Yeah. Like it's going to grab onto it and pull it up.
Well, it's like therapists, when we talk about working your glute muscles,
Right.
it's very common. Since I started therapy back in the 80s, is the teacher would say, well, pretend you got a quarter between your butt cheeks and you're trying to squeeze that quarter so it doesn't fall out. And it's like, boy,
It works.
Patients really respond to it. They do it right.
Yeah, you won't want to do that now because you're not trying to move the butt cheeks.
Yeah.
But this is the one that I thought worked the best for me and for people. It seemed like, so again, the perineal body is that area between the vagina
Yep.
and the anus, or the scrotum and the anus.
Right.
That area right there, if you put your hand on that, again, you won't want to do it in public, but you just put your hand there. When you do it, you'll feel it lift up.
Sure.
I think that's the best cue you have.
Mhm.
It seems
Yep.
like it works really well.
It's basically biofeedback. You're feeling what's going on with
Well,
those
speaking of
muscles.
biofeedback, the other one, and we can laugh because we're men, you can actually see your penis lift a little bit
Oh.
if you're doing it right. So
I have to laugh.
we should have seen it. I should have said, see if you can not laugh and see if you're not there. Again, we're laughing, but we know this is a serious
Well, for
problem. We
goodness
really
sakes,
do.
You got to have fun with life, don't you?
Yeah,
Bob?
I know, because it's a
We'll get comments.
terrible
whatever.
thing. So you wouldn't be doing this after surgery unless your doctor has okayed it,
Right,
and
right.
you don't do it with a urinary catheter either.
Sure.
You don't do it in
Right,
that place.
yeah.
So that's it, Brad. I know we're not experts on this, but it's definitely it's helped me with some issues, and we'll talk about that in another video. So
Very good, Bob.
all right, thanks for watching.